Hello, everybody. Today we're going to talk about human factors and usability, and we'll discuss it based on two recent documents, the ISO 62366 and the FDA guidance document, which was just released this year. A good definition of what human factors is found in the FDA guidance. It's understanding and optimizing how people use and interact with technology. Why do we consider human factors? Well, the reasons are that less skilled users, including patients in the home, which is becoming a big area for device development, are now using medical devices which have become more complicated. The FDA, in their studies of post-marketing devices, found that greater than 1/3 of medical device incidents involve use errors, and greater than 1/2 of device recalls for design problems involve the user interface. So there's a great deal of emphasis on human factors. QSR preamble also states that user error is considered to be a device nonconformity because human factors should have been considered during the design phase. And IEC makes a similar statement. Manufacturers must demonstrate that their device enables users to perform tasks with little or no chance of an error that could cause harm to patients or themselves. The definition of a use error is the user action or lack of action that was different from that expected by the manufacturer and caused a result that was different from the result expected by the user, was not caused solely by device failure. So the person can operate the device what he thinks is correctly and still have a problem. And the third part of the definition, did or could result in harm. There are three major components to the device user system that interact and create problems: the device users, the use environment, and the device user interface. Human factors studies should start at the beginning of the development program and continue through the project. You don't want to begin your human factors studies toward the end of the development when you have firm prototypes. The two controlling documents are the FDA guidance Applying Human Factors and Usability Engineering to Medical Devices, 2016, February 2016 to be exact. This is available on the FDA website for free. And then the ANSI IEC 62366, issued in 2015. How are we going to do this? The program is basically a sequential development of documents that require various studies to be completed, and then these factor into further documents. And I'll go through them briefly now, and then we'll go into detail of each one. From the previous information, we'll create a user interface specification, technical requirements for the user interface. We will then create a user interface evaluation plan. How are we going to verify and test the user interface? The next document is the use specification. It starts off with a device description. What is the device? What does it do? The device intended use. The next step, using all this previous information as input, is to do the hazard analysis. Now, some definitions for the hazard analysis. Hazard is a potential source of harm. The hazard analysis is first conducted while the design inputs are being finalized. And again, for the reason that you want to be able to factor the results into the requirements and early into the design. The use specification and the possible use errors that were identified earlier are an input to the hazard analysis. There are priorities for use error mitigations. The top priority is by design. You want to design out or not design in problems. For example, you specify connectors that cannot be connected to the wrong component. The inputs to the user interface specification are the use specification, which, as you remember, includes the intended use, the use environment, the profiles, and the scenarios. Is to create the user interface evaluation plan. How are we going to evaluate the effectiveness of the user interface? There's two types of formative evaluation methods, analytical and empirical. Empirical methods. We can have a focus group. Most everybody is familiar with focus groups, where you have people, users operating a device in a room, and there's cameras, and there's two-way mirrors, and all that type of thing. Standard validation definition is confirmation by examination and provision of objective evidence that specifications conform to user needs. That you have done enough preliminary or formative testing so that your validation, final validation testing, will not produce a big analysis effort. The IEC document doesn't say much about a report. The FDA emphasizes a report, especially if you are using the human factors as part of your market submission, 510K, PMA, whatever. And the guidance contains a detailed report template. I won't go into detail because it's very detailed and self-explanatory, but now there's quite a few references that are very useful, people should have in their libraries. SOPs for human factors, there should be a separate SOP for each of these, the plan, the use specification, the hazard analysis, the interface specification, the evaluation plan, the design verification, validation, and an SOP for a final report.
Thank you all from Compliance Training Panel.